Good morning, I'm Dr. Grant Garcia, and this is our second round of our blog at Orthopedic Specialist of Seattle. Again, I'm a sports shoulder surgeon here, and today we're going to talk about slab tears. This is a controversial topic. First, let's start by explaining what slab tears are. Again, it's a tear of the superior labrum from the back to the front, so anterior, posterior. It's better to understand this with a visual, so again, I'll show you a visual like we did last time. So as you can see here, we have the shoulder socket and the ball. And around the socket is a labrum. You can see the labrum right there. What's confusing about this is the labrum actually on the very top has the biceps tendon, that's the biceps muscle, attached, goes all the way to the front of the shoulder. So when you get pain from a slab tear, it can come from inside the joint, right at the actual tear itself, or at the front of the shoulder, and that's why this can be confusing for both the symptom treatment and for the algorithm we use to fix people and make them better. So in general, slab tears are not always need to have surgery. Around 30% of Major League Baseball players actually are found to have slab tears, and this can be compensatory to allow them to throw faster, but we don't do anything surgical to these types of patients. Now for this blog, we're going to talk mostly about recreational throwers and sort of the average population, so it's a little bit different than the treatment regimen for a thrower. In general, this is a complex topic because you can have pain, as I mentioned, inside of the joint as well as up top. And generally, people describe this pain as sort of a deep aching pain in the back of the shoulder, sort of like a knife. We try to first start with anti-inflammatories as well as a good physical examination and physical therapy. If that doesn't work, the next step we try is a cortisone injection into the joint. Again, this is really important. It can be both treatment oriented and people can go around and not have any issues afterwards, or it can be diagnostic and we can determine whether the slab tear needs to be addressed. Again, it still gets even more confusing because even after the cortisone injection and through this diagnostic, there's a number of treatment options. In general, we have three major treatment options. One is that you can fix the labrum that I showed you. The second is you can remove the biceps from on top of the labrum and attach it in the front. That's called the biceps tendinitis. And there's sort of this newer gray zone that we talk about, and that is where we remove the biceps tendon, fix the labrum depending on how large it is, and also do the biceps tendinitis. Now you're asking, well, why do we have all these different options? Well, we found that people we just fixed the labrum with, and this is over the last 10 years, about 20 to 30% of them are not happy. And that's much higher than our sort of average surgery that we do. And the reason being is that they either get stiff, usually patients that are a little bit older, and we're talking about 40. And the other issue is that patients get what we call biceps tendinitis. So they may not start with that pain in the front of their shoulder, but once we fix the labrum, the pain goes to the front, and that can need a secondary surgery or further intervention. Now, if you asked me about this 5 years ago, and you said, what is your cutoff to start repairing slab tears versus doing the biceps tendinitis, which means just removing it from the labrum, I would tell you it's around 40 years old. Now, over the last 5-10 years, we've lowered the threshold to around 30 years old. And so anybody under 30 years old, we consider fixing the slab tear and not doing anything with the biceps. Above 30, we consider doing biceps tendinitis, so again, removing it and reattaching it. And so those are the two main things. Now I've got a gray zone that it depends on the patient, and this is why we have to have a custom approach. So 30 to 40 years old, we may fix the labrum depending on how large it is, and then do the biceps tendinitis. Again, recovery for this is return to sports around 5 to 6 months. But it's important you have someone that has fellowship training in this because this can be a complex topic. One, to even diagnose the slab tear because not all of them are painful and not all of them have symptoms. And two, to demonstrate the appropriate regimen. And three, the arthroscopic skills to fix the labrum or decide whether you need to have the biceps tendinitis. Again, if you need further information, go to my website at www.grantgarciamd.com, or to make an appointment, you can use my website or search us at Orthopedic Specialist of Seattle. Thanks.